So let's talk about knees and hips. So a lot of you may be experiencing some symptoms in your knee or your hip right now. The hip, for example. A lot of people experience pain in the back part of their hip, in the buttock area. Well, what's interesting is pain in the back part or in the buttock tends to not be coming from the hip joint. So if you're experiencing pain, let's say, across the front of your hip, in the front pocket, we like to say, across the groin, with walking, with activities, with pickleball, with golf, with pivoting and twisting, and it's in the front, in the crease, in the groin, you may be experiencing pain from your hip joint. And the best thing to do is to start with an x-ray, because you might just find that even though your symptoms started a month ago or 6 weeks ago, very commonly when an x-ray is made in that situation, often the x-ray is worse than you think. And the symptoms just started, but the disease has already progressed to the point where your x-rays are fairly advanced. Now, what do? Well, that's when you pick up the phone and you call me so you can come into the office and I can do a thorough workup on you. I can x-ray your hip, I can examine your hip and give you an idea about how to proceed. Now, that doesn't mean you're going to jump right to surgery. In fact, most of the time that's not the solution. A lot of times it's some physical therapy. It's an anti-inflammatory prescription. It's maybe a cortisone shot into the joint. Maybe it's a weight loss program. Maybe it's going to the gym to use a stationary bike for a few weeks. A lot of times, that's all it takes. But it starts with an x-ray, it starts with some simple treatment, and if that doesn't work and your lifestyle is compromised or you can't be the active individual that you desire, that's when it's time to consider a surgical solution, and that's when I come in. And that's where we may have a discussion about robotic-assisted knee replacement surgery. And what's interesting about knee surgery is a knee replacement doesn't have to be a full knee replacement. You can actually replace just one half of the joint. It could be the inside part of the joint. It can be the outside part of the joint. It really depends on the degree of disease in the knee, and it really depends on the intraoperative findings, what we see in the knee when the knee is exposed to us. If the arthritis is localized to one area, the symptoms localized to one area, sometimes the best solution with the quickest recovery is just to replace that portion of the knee with a partial knee replacement. The nice thing is when we do it with a robot and we do it with extreme precision, the likelihood of a long-lasting result is there. So you're not getting, with a partial knee replacement, half the results or half of an operation that's going to have to be repeated in 5 or 10 years. You're getting results that should last as long as a full knee replacement, 20 years plus. That's the goal of partial knee replacement or full knee replacement. So we're not going to sacrifice by doing a partial. One exciting thing that we're bringing to the area that is an evolving area of orthopedics is same-day joint replacement surgery. So what does that mean? That means you go home the same day. So you come in the morning, have your hip replacement, or you have your robotic-assisted knee replacement, and for the right person with good support at home, you actually go home the same night, sleep in your own bed. Now, how is that possible? Now, that's possible for several reasons. Number one, our surgical technique, where we use very effective tissue-sparing techniques in surgery. With robotic-assisted surgery on the knee, we minimize bleeding, minimize swelling. For hip replacement surgery, we use tissue-preserving techniques to lessen the tissue trauma. So the first several hours of your recovery, the pain is controlled. We get you up walking within 2 or 3 hours of your surgery. With our approach to same-day joint replacement surgery, it starts the night of surgery. You actually are going to come into surgery hydrated. It's no longer that you can't eat or drink anything after midnight. Yes, you cannot eat anything after midnight, but you're going to come to surgery hydrated. Within 2 hours of your arrival time, I'm going to have you drinking liquids. And then when you arrive, We have a special recipe of medication we give you. We use special anesthesia techniques. We use special surgical techniques that lessen the tissue trauma. And as a result of our program, people often, within 2 or 3 hours of their surgery, are walking the hall and doing it in a way where their pain is controlled. They're not having a terrible limp. You may use an assist device like a cane or a walker, but you're able to do it with very little assistance by anybody. And if you can walk and you can have your pain controlled and you're not sick with the anesthetic, there's no reason you need the hospital. Part of our same-day program, we have a home health nurse check on you the morning after your surgery. They check your vital signs. They make sure your wound's good. They troubleshoot any medical things that are going on, which fortunately happens very rarely. Then you have a therapist visit you. So there's a home health therapist that visits you that afternoon, the day after your surgery. So there's this seamless transition of care where you almost feel like you're in the hospital because you're having people wait on you the next day, but in the comforts of your own home. And then the program extends to several more home health visits, 2 or 3 more the first week, just to make sure that everything is right on track. For our same-day robotic-assisted knee replacement patients, we have the same program with aggressive hydration the night of surgery. Special recipe of medication, very similar to what we use for the hip. The nice thing about a knee is we have a special nerve block that our anesthesiologists have perfected called an adductor canal block, which allows for very little pain in the first 24 to 36 hours, but also normal function of the leg. So just like with same-day hip replacement surgery, with the knee replacement, within 2 or 3 hours of the surgery being over, you're up walking in the hall with a cane or a walker with very little assistance, often with no pain. And if you're able to accomplish that, you get to walk right out the door and spend the night in your own home. And then the next morning, the protocol is for a home health nurse to check on you, check your vital signs, make sure your blood pressure is good, make sure you don't need to hold your blood pressure medicine, check your wound, and then later that afternoon, physical therapy begins with a visit from the home health physical therapist.